Hi, Monty Pal here on behalf of GU Oncology Now. Today we're going to be talking about updates in kidney cancer with three of my dear friends. We're going to start with a quick round of introductions, beginning with you, Cristina.
Hi, I'm Cristina Suárez. I'm a medical oncologist at Vall Hospital in Barcelona, Spain.
Dan.
Hi folks, Dan George from Duke. I'm a GU medical oncologist and happy to be part of the panel.
Awesome. Brad.
Yeah, and I'm Brad McGregor, also a GU medical oncologist from Dana-Farber in Boston.
Awesome. All different parts of the world here. Monty Pal from Los Angeles, California, and we're going to dive right in. You know, Cristina, you had some really beautiful data at ASCO last year related to depth of response, and I really like that. Could you share that with us and kind of go through that?
Yeah, sure. So you'll know the data, but we present data about depth of response and relationship with outcomes in the CheckMate-9ER trial. And what we found out was that more patients had deeper responses in the Nivolumab arm than in the Sunitinib arm. And in both arms, but especially it was the relationship was even more linear in the Nivolumab arm. There was a direct relationship with PFS and with overall survival. So patients with deeper responses had better PFS, better OS, and patients with good shrinkage, like 80%, it was more or less that having a complete response. So I think that for me, response is important.
Does it matter how you get there? Like if it's just the drug alone getting you that depth of a response, or if you add like a little radiation therapy or debulking nephrectomy or something else?
We didn't check in the trial. Okay. We don't have this data.
You know, I'll tell you, I actually lean on this data every now and then with patients in the clinic because, you run into patients and obviously their goal is to eradicate their disease completely, right? They want that complete response. Where I find your data so helpful is for that patient who really achieves that deep response, right? I think you called it a PR1 in your trial, 80 to almost 100%, right? So they're almost there and their outcomes are outstanding, almost in parallel with what, CR might be.
Is this going to be the tail of our curve that Brad's referring to?
I think that might be it.
No, and I have even patients with these responses that I had to stop. For example, I have one patient that I had to stop Cabo because of toxicity, and he's without treatment for 2 years, and the response is maintained, and he's without treatment now.
Wow.
So these deep responses, I think they are very of good quality response.
What's the timing of these deep responses? When do you see them, and do you keep seeing these things all the way out to 2 years?
Usually, yes, I guess. We don't have the numbers, but I don't know in your experience, but when a patient has a very, very good response, it's like long response.
Yeah, and I've seen patients where I'm doing scans, I'm still seeing some decreases all the way out. It may not be a lot of percentage, but patients still like, a year plus out, and the tumor's still shrinking. Yeah. It's kind of remarkable when you think about this
and
mechanism.
After some CT scans with the stable disease, and then go down
and then
again.
Goes down a little bit more, and you know what? Everybody loves that.
Yeah. I'm very surprised when I found that, and the patients as well, like, really?